The past couple of years have been incredible for the advancement of dry eye therapies. We've seen treatments like IPL, Gland Expression, and Radiofrequency become more mainstream. But many of these newer dry eye treatments are expensive or not covered by insurance or both. So how do you decide which expensive treatments are actually worth it so you don't break the bank in treating your dry eye? Welcome back to Eye School with me, Dr. D, where I teach you about products and treatments related to dry eye syndrome and eye beauty so you can have healthy, beautiful, comfortable eyes. Give a little love tap on that subscribe button down below to stay up to date with all the latest eye tips and tricks I have for you. Before we get into specific therapies, remember that there are basically two goals to consider in dry eye treatment. So ask yourself what you're trying to accomplish with any given therapy before spending a ton of money on it. The two goals are reduce inflammation and clear obstruction. If the treatment isn't going to solve an issue you have, it is never worth the money. And make sure to check out drmelaniedenton.com and download my free guide to toxic ingredients in cosmetics, as well as my other dry eye guides that I have put together for you there. All right, so my first expensive dry eye treatment that I feel can be worth it is autologous serum. Autologous serum drops are made from your own blood and are able to mimic the biochemical properties of your natural basal tears since they're made from your own blood, your own body's system. To get autologous serum, you first give whole blood, typically a good number of vials, 6 to 10, depending on the concentration. Then the blood is separated by centrifuge, after which it's diluted to the concentration specified by your doctor with sterile saline. The drops are then frozen, which is how they have to be stored by you as well until their use. Autologous serum is wonderful because it contains proteins, growth factors, vitamins A and C, antioxidants, and electrolytes. The components actually are almost identical to those of basal tears, but are typically in an increased concentration. Now the downside, we know they're in this video, so they're typically much more expensive than artificial tears, but they're way more useful. Due to the growth factors and anti-inflammatories, these tears work to heal your corneas. Which leads me to the second treatment that's expensive, but in my opinion can be worth it. And that is amniotic membranes. Whether you're doing a cryopreserved or a dehydrated amniotic membrane, these little pieces of tissue pack a serious healing punch when it comes to dry eye and corneal problems. Here are some of the things these powerful tissues are capable of. They facilitate neutrophil apoptosis. They polarize the M2 macrophages, suppress Th1 and Th17 lymphocyte activation, and that all reduces inflammation. They prevent myofibroblast differentiation to prevent scarring. They maintain stem cell quiescence to promote regenerative healing. So think about it. We're hearing words like regenerative healing, prevent scarring, reduce inflammation. All in all, the things that promote growth in a fetus, you can imagine would also promote growth and healing in the human cornea, and that's essentially what we do with an amniotic membrane, harness the healing power of the amnion. Now, the differences with these, yes, they're expensive, but amniotic membranes are able to be billed to your insurance, so this isn't usually an out-of-pocket expense unless you have a high deductible plan. But if it is indicated in your care for severe dry eye or filamentary keratitis or even recurrent corneal erosions, it's definitely worth the healing power it brings. You know I was going to talk about IPL in this video. I love me some intense pulse light. It's my personal favorite dry eye treatment. And Luminous did receive FDA clearance for their OptiLight device earlier last year in 2021. Intense pulse light has been used for over 20 years with over 50 studies demonstrating its efficacy in dry eye disease. IPL targets pigment, so it's very effective in patients with rosacea at decreasing the amount of telangiectasias or little blood vessel growths present on the skin. And we know that the presence of ocular surface inflammation increases when you have increased telangiectasias on the face. And so by treating the face for these abnormal vessels, the ocular surface inflammation decreases. And in addition, IPL changes the secretion of the meibomian glands and even rejuvenates glands that have begun to atrophy. It decreases the population of Demodex mites, my all-time favorite YouTube video from Dr. Perryman, I'll leave above, of IPL killing a Demodex mite. After IPL, tear breakup has been shown to increase and symptom scores also improve. I made a video about what to expect with IPL treatment that I'll link here, and if you have the opportunity to try IPL for your dry eye, I would highly recommend it. Now here's the kicker. This treatment is not covered by insurance and in general will run you $1,500 to $2,000 for 4 sessions, depending on the part of the country you're in and the doctor you see. Next on my list of expensive therapies that are so worth it is gland expression. Unclogging the meibomian glands and reducing the obstruction that occurs with meibomian gland dysfunction is very important to your long-term care if you have dry eye syndrome caused by MGD or meibomian gland dysfunction. Unclogging the glands in my clinical experience helps with the signs and the symptoms of dry eye disease. There's several common procedures for this. If you watch this channel, you know I do tear care, but there's tear care, iLux, MiboFlow, LipiFlow. Tear care is a warming device that delivers heat to the glands, and within 3 minutes after the heating session, meibom clearance, or squeezing the glands, is performed by the clinician, and that allows me to spend as much time as is necessary to evacuate your glands. Each of the 4 lids are compressed individually, and when you compare it with a warm compress at home, twice a day for 4 weeks, tear care is far superior in improving tear breakup time 1 month after the procedure. Although it's another out-of-pocket procedure in terms of being cash pay, this has become a mainstay in my practice just because there's no other way to clear obstruction. Warm compresses have not shown to be as effective in studies, and so in my opinion, if there is an obstruction present, you must work to clear the glands. And then finally, I included on this list immunomodulators, which have been around a long time, but prescription drops are another important player in reducing ocular surface inflammation, but they too can be expensive and not always covered by insurance. Restasis, sicca, and Xiidra, however, make a serious impact on turning the course of progression around in dry eye disease and should be considered. Treating dry eye disease can feel complicated and very expensive. It is true that some of the most effective treatments are out-of-pocket costs and can add up very quickly. I hope this list has helped you to determine which of the treatments might be more necessary for you to spend your hard-earned money on. And remember, at the end of the day, the treatments that you choose should be addressing your inflammation and the obstruction of your glands. Spending money and chasing down treatments that don't accomplish those 2 goals are pointless. However, the treatments above all have proven track records of helping with those 2 key components of dry eye treatment. So make sure to let me know in the comments below which of these more expensive dry eye treatments you've tried or are hoping to try in the near future. And if you happen to have made it this far and you're not already subscribed, now's a great time to do that. Just hit down below and make sure you hit the bell so you don't miss notifications. That's it for today's iSchool. Class is dismissed.